afternoon. Thank you so much for joining us for our Lunch and Learn series today. We sure are glad that you have taken time out of your day, particularly your lunchtime, to join us for this very exciting Lunch and Learn series. This event is being brought to you by Black Funders of St. Louis. I am a proud member of Black Funders, and I am pleased to share that we are a local giving circle. And for us, we contribute $300 for our membership, and that goes to support all area Black-led nonprofit organizations in St. Louis. Since 2017, when we were established, we have contributed over $19,000 to local organizations to help build capacity, to identify strategies for their growth, and just overall sustainability within the community. We're most proud of our partnerships with local nonprofits, and we're glad that you're here today to get information that's going to help your nonprofit organization. At this time, I'm going to hand it over to a fellow member, Trina Thompson, and she's going to talk to you a little bit more. Oh, but before I do, sorry, housekeeping, just to let you know, we are live streaming today's event over Facebook. We encourage you, please, to use our chat for any questions that you may have. We will have an opportunity for question and answers at the end. This is also being recorded today. Thank you again for joining us. Trina?
Good afternoon, everyone. I'm Trina Thompson. I serve on the membership committee for Black Funders of St. Louis, where I focus mostly on time and talent initiatives along with my co-laborer, Marnay. Today's session, we're going to focus on measuring success, how to effectively evaluate your organization's success. We're going to be discussing things such as how to explain your theory of change for your organization, develop goals and measurable outcomes, how to calculate that social return on investment. And we're joined today by Dr. Vetta Sanders Thompson, who it's an honor and a pleasure to have her with us today. We hopefully will glean a lot from her wisdom that she's going to share with us. Dr. Sanders Thompson is the E. Desmond Lee Professor of Racial and Ethnic Studies at the Brown School at Washington University. She received her bachelor's degree in psychology and social relations from Harvard University and her master's degree and doctorate in psychology from Duke University. Dr. Sanders Thompson serves in a number of capacities at WashU. She's the co-director of the Center for Community Health and Partnership and Research at the Institute for Public Health. She's an associate member of the Siteman Cancer Center. She's a faculty affiliate of the Department of African and African American Studies, as well as the Interdisciplinary Program in Urban Studies. As a licensed psychologist and health service provider, Dr. Sanders Thompson's research is focused on the health and well-being of ethnic and racial minority communities, particularly the African American community. She's a noted researcher in many areas, including racial identity, psychosocial implications for racial and ethnicity in health behavior, and social cultural determinants of health and mental health disparities. I hope you all are ready and willing to listen to all she has to share with us today. So welcome, Dr. Vetta Sanders Thompson.
Good afternoon, everyone. I'm going to first share my screen, and then we'll get going. I will begin by saying I am also a proud member of Black Funders of St. Louis and have been a member from the beginning. And so I want to thank Black Funders of St. Louis for hosting this event and all of the great events that they host. They've hosted over the years and will host this year as well, and for asking me to do this and for being here. Now, that bio didn't explain why I would be asked to do this, largely because at this point in my career, I spend most of my time in some way completing research, and given the intervention projects that we work on, being involved in some way in evaluation. And so that's the reason I was asked to come in today and share a few thoughts with you. I'm going to take you through some evaluation basics. My goal is that in this short session, you will be able to refresh and update on the basics. For those of you who have some background, if you don't have a background, you'll gain a few tips and leads that will help you develop your skills in this area. And so I'm going to hopefully help you learn how to explain your theory of change for your organization. If you haven't developed one, this session should spur you to do so. I'm going to explain some important components of program evaluation. And from this, most of you would be able to share this information with your colleagues with whom you'll be collaborating on evaluating your programs. We'll talk a great deal about developing goals and objectives, because those are key for strong evaluations. They help you with your measurement. They help you with your analysis. And we'll talk about how to use the data to isolate areas of improvement for your organization. So what is evaluation? It's really just the use of some systematic approaches. You're really using some standard research methods to investigate and assess, the quality and the effectiveness of whatever programs you're running, of your organization as a whole. The scope and magnitude of evaluation really rests with the organization and the organizational leadership. Some things that people evaluate, they definitely evaluate projects and programs. Funders or potential funders will want to know what you've done in this space and how you've done it. And, that can be a component of your score for a successful application. People develop evaluations for service lines that they have, their infrastructure, conditions in the community or the organization that they're working with, and larger systems as well. So your evaluations, if they're focused on your organization, depending on the size of your organization, they can be large and expansive, or they can be smaller and much more focused than they might be in larger institutions. If you have a background in research but not evaluation, you can probably read a bit. You can attending this seminar is a good start. You could do a few others, and you can probably move forward. The tools that you will be using in evaluation are basic tools that we find in research. And so if you've got that background, this is not a sort of heavy lift. But the difference between, I think, research and evaluation is the way you think about the issues that you are addressing, the reason you're doing the work, and what you think about shifts when you're doing evaluation as opposed to research. And so the key is that the approaches in both require that you be clear and that you be systematic in what you do, and that others be able to understand what you've done, and even be able to think about how they could reproduce what you've done, either for follow-up or to substantiate some of the claims that you make, and that it makes sense. So why do we do evaluations? They're mostly to be able to demonstrate to others the effectiveness of our work, the quality of our work, But the other reason is that we want to facilitate improvements in the work that we do. There is no perfect program, no perfect service line, no perfect institution. And we can all do some self-examination to learn more. Take what we get, that information, that data, and make changes. Decide where we want to move our resources, putting more resources in some areas, using certain programs more because they've demonstrated greater effectiveness and greater ability to promote change, modifying some projects or program lines or service lines to be more effective, cutting what doesn't work, amplifying what does. And sometimes it tells us to drop some of our activities. If they're not working, if they're not producing results, perhaps they're no longer needed. So it helps us with those things. So bottom line is you're able to identify program gaps, maybe where you don't have services, your assets where you have strengths. You understand better where your resources are going and how they're affecting your implementation, as well as your impact in the work that you do. One of the things that I have done is I have sort of just placed on the slide a CDC tool and resource that you can actually Google that will help you in your work beyond this webinar. If you go to the CDC website and search for their self-study guide and program evaluation, that will be a resource that you can use. In addition, they have a number of resources on their website. Some of the slides, not slides, but some of the diagrams that I will show you today were developed as a part of the CDC program evaluation effort. And so you can go online and take a look at those and read what they have to say as well. So benefits of evaluation. When we go through the steps in the evaluation process, you'll see why it says increased communication. Because in order to do good evaluations, you got to talk with your stakeholders. You got to have communication among staff and administrators of your organization. And really, that communication begins when you're thinking and planning for a program or a service line or planning your evaluation, and it continues through the dissemination of that. Program evaluation evaluation of any sort really facilitates dialogue among people, because you can't do it well unless there is communication among all the people involved. At the end of it, one of the things beyond being data and information that you can plug into grants for funders, it highlights successful activities, programs that work, contributions of the organization that you should be sharing within the community. None of us should be hiding our light under a bushel. And it's important that community members and other stakeholders know what you do well, because that can facilitate opportunities for collaboration and growth and development. It allows you to monitor your progress and to do better. And as I said before, to make modifications. Now, in saying all of this, good evaluation doesn't necessarily guarantee you funding, because funding involves a lot of other things, including politics, competing needs, and community preferences that come into play in decision making. But I will say, while it doesn't guarantee that funding, it helps you in a number of other ways, and it also helps with funding. And so moving us forward, as I said, I'm showing you now the CDC framework for program evaluation. And you can see one of the first things it talks about is engagement of your stakeholders. And that's where that communication that I mentioned comes into play. But because I think most of you know a lot about engaging stakeholders and good, strong communication in your organizations. I'm not going to talk about that stuff, but I want to take a quick look at this visual of the process, and so that you have a better understanding of some of the elements that we'll talk about. When we're talking about a theory of change, really what that is going to help you do is that second step in this evaluation framework. And that is, it's going to help you describe your program. You cannot do a good evaluation if you do not have a good, strong grasp of the program that's being implemented. Who is doing what, when, how, where, with whom, for how long, what are the starts, what are the endpoints. A good theory of change will help articulate that. You can extrapolate what you need from that to your evaluation design. And so the next thing then is to focus on that design. Who are you going to talk to? Where are you going to, how are you going to gather information from schools over what time frame, using what strategies, to understand what outcomes, and ultimately to be able to talk about what impact. And we'll talk about logic models. Logic models help a great deal with this. And one of the things I'm going to talk about is that interplay between theories of change and logic models. And then after that, you're gathering that information, that evidence. And that's where some of those basic research skills come in. The methodologies used in both evaluation and research are often the same, and they overlap. And then after that, there are two elements that I'm not going to talk about as much today, and that's really coming back to stakeholders, checking in, using the data and exploring those data with them to justify the conclusions that you're drawing, and then making sure that you follow up and that you share the lessons learned, the information within the organization and institution with your staff, so people can grow and develop and participate in the change that you may need to make, but also with the community, other stakeholders and funders, and then you're beginning that process over again. And so now we can get to the work of evaluation. Now, step 2 is describe the program, having a comprehensive description of everything you do. You review that mission and vision, because one of the things you want to make sure is before you initiate an evaluation is what's being done. Are those goals consistent with the mission and vision of the organization? Is everything in alignment? That's always important, because if the goals are out of alignment with the mission and vision, then there may be other work that needs to happen. And you need to be able to plan for that in terms of your evaluation and who you speak to. Your understanding of an organization based on that mission and vision may lead you to believe that a certain set of people, groups, organizations are stakeholders. But if the goals of the organization are now aligned, that may not be true. And they may still want you to do a service line or program evaluation, but it will mean that you might have to shift the way you think about that and talk to people you didn't anticipate talking to about things that you might not have anticipated you would have to discuss. So that framing matters. And so, reality is that because those goals matter, you need to understand, what's been put in place. What was the start time of the project, or what is the start time of the project? When are activities supposed to take place versus when are they taking place? And when do they end? So that timeline, what exactly are people doing? And what are the outcomes of any particular activity? Why are they being conducted? What do people expect? What do people do? What do they expect? Ultimately, You also want to know what the whole system, what the whole program, or what the whole service line is expected to accomplish. How are you making a difference? How are you creating change? It helps if the organization has set up goals that were created as what we call SMART goals. But sometimes that's not the state of affairs. If it is the state of affairs, they've made your life easier, your job is easier. But if not, one of the first things you might want to do is spend time with the staff at the organization or with leadership, figuring out, how to make these goals or how to translate these goals in hindsight into SMART goals, because it makes your job of figuring out that evaluation a lot easier. And one of the things I want to say is that a lot of times people feel like evaluation requests from funders or evaluation period is a chore. What I want to say is evaluation is not a chore. It's really about your success. You can perform better. You can make changes quicker if you are constantly thinking in this way. You catch things that you wouldn't otherwise catch. You correct things that require correction, and you do a better job for the people you serve. So we want to keep that in mind. Now, I'm talking about SMART goals. What do we mean by that? The acronym stands for specific, measurable, attainable, relevant, and time frame. People change the lead words in that acronym from time to time, but ultimately, whatever they're using, it gets you to some basic points. You want to look for goals, or you want to structure goals that tell you who is doing what. And you want to know how. That how sets up how you're going to measure things. Whether you're going to be using qualitative techniques, whether you're able to use quantitative techniques, and then exactly, if you're using quantitative techniques, exactly what are you going to be measuring? That's the reason you want it to be specific and you want it to be measurable. You also want these goals to be attainable. You want goals that are realistic. People often set goals for themselves, their organizations, their programs that are not achievable in the amount of time that they have. If you've got to do a 6-month report or a yearly report, you have to have structured your activities so that it is reasonable to expect to have achieved some specific outcome at that time point. And if you haven't really set your activities up that way, or if you weren't thinking about that way, that evaluation is going to be that much harder. Being realistic and setting up things that are attainable help you. If you don't, sometimes an evaluation may actually make you look bad because you ran out of time. The evaluation can't show the outcomes that you have promised in the time frame that you promised them. Now, we know things sometimes start off slowly. Sometimes you run into barriers midway. Things happen. But in a good evaluation that had a good time frame to work from can compensate for that to some extent. But what you can't compensate for is poor planning, where people never thought about how each activity impacted every other activity and influenced the outcomes that you could achieve in a certain amount of time. So that becomes very important. But in talking about outcomes, that means your thinking when you're developing your goals has to be results oriented. Activities are great, and some of them are really worthwhile. But you've got to know worthwhile in achieving what. And you need to specify that early, because some of the what that you might want in terms of an outcome, I'll give you an example. I might want to lose 30 pounds in 4 weeks. I want that, and I might need that. That doesn't mean I can do that. So let me back up and think about, what can I really do? I might want to see a 10% reduction in obesity in North County in a year. But what it takes for people to reduce their BMI, to lose weight, to change their eating habits and their physical activity habits, and to have all of that align with reductions in weight, and to have enough people do that to see a 10% reduction in obesity rates in North County, that in a year, that might be a little ambitious for my organization. So that's not a goal I want to set up for myself. Maybe I'm thinking about a specific church or a specific school or a specific group of children who I can work with them, I can work with their parents, we can develop plans that help them collectively do this. And then we could say within that group, we are looking for a 10% reduction. That is a lot more manageable. So that's what we mean, and that's being results oriented. And the time frame, you really have to really think about, what does it take to move you to success on any outcome? Now, why did I spend so much time talking about this? Because it matters. To do a good evaluation, things have to be set up for you to be able to measure what people have set up as their outcomes, and their short-term, their intermediate, and sometimes their long-term goals, as well as to be able to speak to some extent to the impact that they're having. And so just a little bit more on developing those SMART goals. Really, when we talk about the who or the what, we're talking about individual participants, but we're also talking about other organizations, your organization and other organizations you might be working with to achieve those goals, but also other entities and institutions. You also want to be thinking about in these SMART goals the change that you want, the desired effect. Do you want things increased or decreased? It would not make, and that really depends on the problem or the issue that you're selecting. In some instances, with larger scale organizations, maybe it's something you want improved or modified. And if you're working with other institutions or larger systems, maybe it's a policy that you want adopted or one you want better enforced. When you're doing evaluations, you may be working with increases in knowledge, what people know, what they understand. So sometimes you're just raising awareness. You want people to know about an issue, a concern in the community. Because sometimes the beginning of work is raising awareness. People won't change, can't focus on, don't try to understand things that they're not aware of. There are times when we're focused on behavior. And then, as I mentioned before, there can be policies, procedures, practices, other things like that we're focused on as we're working. And here I'm just giving you an example. I use an individual example just to let you see one more time what we mean by a SMART goal. So, and I always like these because I tell people, if you practice them personally, it makes it easier to practice it in your work, thinking in a very specific and strategic way. So this one is set up for a goal of eating healthier. What do you want? I would like to eat more vegetables. Fine. That's very specific and clear. All of your programs should have very specific and clear expectations for what you want to do, what you want to have happen. It's easy for them. I think about it and then I say, okay, so how much and how often will I do it? That's easy for me to specify. I want to eat 1 serving of vegetables every day. Now, of course, I want to eat more than that, but I know that I want to do that because that's a bare minimum. If I were already eating 1 serving, so that's a note to you all, you might want to have a baseline. When you start an evaluation, sometimes the organization will bring you in early enough, or if you're evaluating a new program or a new project or service line, you can come in at the beginning and you can get a baseline. What's already happening? What's already there? How are people already performing? What do they already know? You get that baseline, because it may be that you say, I'm already eating 1 serving of vegetables a day. I went and I read about the measurement and I'm doing that already. So now what I want to do is I want to add 1 additional serving, or maybe I want to add 2 servings. Okay, so now you got some specificity. If you got that baseline organization, what if you want to reduce the level, the BMIs, you want to reduce the level of obesity among this group of adolescents in this organization that you're working with, and you now know that 60% of those youth have a BMI that is above the standard for their height and weight. We don't call adolescents obese, so we're going to have to drop that, and we're going to have to think about BMI now because that's the standard. Okay, so we want a 10% reduction in their BMI of the youth that are exceeding the standard or average BMI for their height and weight and age. Okay, so that says, hey, it was good that I got that baseline, because now I can demonstrate that my program actually made a difference, had impact, made a change, because I know where they started out. I can track where they're going. And in doing that and having that baseline, I can get measurements and data at different points. As we say, add in the food program, then we add in the physical activity program, and then we've developed some support groups to talk about, what's going on in our lives that help us to keep track and eat healthy and be physically active, avoid emotional eating and the things that drive us to that, and we're supporting each other. And as we add those programs, I can see what kind of change are people able to make. Does it go up or down? And I can measure that. So you say, how will I do it? That's all those programs we've thought about that are important to helping those young people look at their weight. And we think about when and how we'll add those in and what we'll ask them to do. How often will we ask them to engage in physical activity? At what pace will we ask them to add fruits and vegetables to their diet? And it's easier to ask people a point. It's easier to ask people to add things than to take things away. Even when you're programming, these are things you need to think about as you think about evaluation, because asking people to drop things as opposed to add things only makes your job harder in verifying that things have happened and that you're having success. Be realistic. Can I do it? Do I have the resources? Do you have the personnel in place to help them plan physical activity that they can do? Do you have the nutritionists to help them figure out what fruits and vegetables they might like to eat, add, and how they can do that easily, how they can do that low cost, to support them in planning each week? Do you have the people to get those measurements, those BMIs, to support the kids when they're successful and when they're not, so they don't give up, all to run your groups? Do you have those resources? Are you able to do that? Or do you have the people to work with the parents and the families? Do you have and get their permission and get them to help and support the kids? And did you give yourself enough time to do all of that? Now, this is the point where the theory of change and the logic model come in. essentially, what I was talking about as I was describing those SMART goals is a theory of change. What does it take to move me from, or a group of young people from having or carrying excessive weight to eating and living in a way that allows them to change that? And so you all, on a theory of change, you always start with what's the problem you're trying to solve. We have unhealthy behaviors in our community, and these are impacting our young people, and we want to do better as a community, and we want to help them to be healthier and do better. So that would be the problem you want to solve. But what are the key assumptions? One assumption might be that they have the opportunity for that. One assumption might be that the community is unhealthy. So what's the data that supports that? You got to go find that. What are the factors that contribute to that lack of healthy behavior? What are the barriers? What are the facilitators in that community? One assumption may be that, there are enough outlets for healthy eating, but people don't want to take advantage of them because of the cost. Well, you got to verify that. If that's an assumption, you got to verify that. And you keep working through in that way. Who is your key audience? Well, in this instance, you could have a number of audiences because it depends on on your resources, your structures, your funding, and how you best use those to begin to make change. So you've identified you want to work in the northern part of, say, St. Louis, because this is where the data say the worst outcomes are. You've decided you want to work with youth because we want to give them a better start. Now you've got to figure out which youth where. You could work in schools, but is that going to be feasible? Is the school open to it or amenable to it? Is the district open to it? Or do you work with a youth serving or another youth serving organization? Do you want to partner? What is your entry point to reaching that audience is what we're really talking about. And then you get to the piece that I was describing in the SMART goals. What are the steps needed to bring about change? And in each of these buckets, there are assumptions that you have to make that you need to get data to verify that these are reasonable assumptions. And then you see that you start working on the portion that I just spent some time talking about, and that's what is the measurable effect of the work. For each component, for each step that is necessary to bring about change, how do you measure that? What's the effect you're looking for, and how do you measure it? Then you start to think about what are the wider benefits of the work. That will probably take you to some of your more intermediate outcomes that you're of interest. And then what is the long-term change you see as your goal? And that's what we're typically talking about as impact. Now, what I want to say here is that this overlaps with what I will discuss as a logic model. But I think that theories of change have come into favor, and then people are increasingly using them and asking organizations to create them because it helps you to think about your problem from beginning to end. It allows you to get that preliminary data you need or to understand the preliminary data that you need. It allows you to check the literature for what works. When you're thinking about what steps are needed to bring about change, that means you should be going to the literature. You should be talking to other organizations that do this work, or going to their websites if you don't want to talk to them directly, to see what they have done and what has worked where for whom. It allows you to bring all of this information and these resources to bear on the work that you do. Some people call that evidence-based intervention. I just call it good practice and not reinventing the wheel. But it allows you to think about this from beginning to end. Now, the logic model has elements of that, but it constricts it a bit and focuses you in laser tight on that evaluation piece. And I think for the purposes of evaluation, while I like theories of change, and I ask people to start there, when you start to think, and it always does this when I don't move fast enough. When you start this, it's also important to understand that at some point you're going to have to focus in on your evaluation components, and that's where the logic model is more focused, and it helps you do that. A good logic model asks you to think of some things that aren't necessarily built into that theory of change, although you actually could, because you can do it the way you want to. You can add some elements in. But in a logic model, you're looking at a set of if-then statements that ask you to look at what resources are needed to run your program or your service line, and then given those resources, what are the activities? If you have access to the resources, then you can accomplish your activities. If you can accomplish these activities, you will have delivered the services you planned, your outputs. Now, funders want to know that you can deliver those services, and they want to know when you deliver them, at what level and quantity. So that's a part of your evaluation too. And then if you've delivered the services you plan, then there will be benefits for clients, communities, systems, organizations, whatever level you're working at. And this process, I think, helps with grant writing, because believe it or not, in writing grants, people are much more interested in the resources needed, the activities, the outputs, and the outcomes, particularly those outcomes, and how you're going to do it, and what's the evidence for what you're going to do. But it also helps you with budgeting, because if you know the resources you need and you know the time frame over which you're going to use them, you can write a better and stronger budget. And so that's the reason I said this is not a chore. This is to your benefit. This helps you achieve success. Now that theory of change will do the same thing, but this logic model is more focused and effort specific. And so if we think about it, what are some of the inputs? Those are those resources. You'll see logic models that will actually call them resources. Some will talk about inputs. Same thing. Staff, money, equipment you need, facilities that you have to have, research that you have to do in order to know what's the data, to have some sense of, oh yeah, we don't call youth obese, so I don't want that in my grant, I don't want that in my outcomes. We talk about overweight, but we also talk about reductions in BMI, those sorts of things. What activities are relevant? Activities can be training, they can be education, they can be outreach, they can be vaccinations, they can be support groups. Remember, in this, I talked about support groups, but it could also be education on nutrition, education on physical activity, but then some training on how to properly engage in that physical activity, how to prepare those foods, how to prepare a menu, those sorts of things. The outputs will be the number of people reached, the number of people actually served, the number of people who participate in any physical activity trainings, any nutrition trainings, and any actual physical activity times that you, or activities where it's actually doing it, and how long they do it, and how many are doing those. Self-reports or diaries of actual inclusion of fruits and vegetables. And then those outcomes, you'll look at your short term, your intermediate, and your long term. Your long term is typically your impact. But you can't get outcomes if you don't have people doing and participating in those activities. And so you're tracking each of those. The third step is really looking at how the evaluation results are to be used. Are they going to funders? Are they being used to monitor progress and make strategic changes for improvement? Are they being used for an end of funding report? You want to know those things as you're designing your strategies. Then you want to be able to describe your data collection, your data analysis, and the interpretation process. Data collection can vary. As I said before, it can be qualitative or quantitative. But in that interpretation process, I really encourage people to engage the people who use the service, engage people you collaborated with. If you work with another organization or school, engage them in that. Also, in your planning of this, talk with them. You don't want to ask people to do things that are too burdensome, that they don't want to do, that they're going to have to do, that's going to make your data unusable. So you need to be talking to people about what's feasible. Now, how often do you want to get height and weight? Once you get height, unless depending on the age of the group you're working with, you may only need to do that at the beginning, maybe at a 6-month point, and then at the end, because thinking about growth spurts, but not everyone will have them and they will vary. But by the time people are in adolescence, they don't change as much, although they do change. They don't change as quickly as, say, infants or toddlers will. So you don't want to make it excessively burdensome. You don't lose a lot of weight all at once. So do you want to do it weekly, or do you want to do it every 2 weeks? And height, you get 3 times. How often do you want them to write in their diary about their food intake and their fruit and vegetable intake? How are you asking them to measure physical activity? Can they just wear a pedometer and make it easy on them and you for that data collection? The data analysis depends on whether it's quantitative or qualitative. And then after that, you've got to summarize the procedures, as well as who's doing what in what time frame. Who's gathering those pedometers up from the youth and making sure that data is properly entered and recorded if you use it. Who's gathering those diaries or having them or monitoring whether they're, say, using a link to a computer site or program that you have, or data collection system that you have, for them to enter it automatically so that there's less cleaning and for easier analysis and more systematic input. Who's monitoring that? Who's checking the data quality? Who's distributing any incentives for them doing that? All of those things have to take place. We talk about different types of evaluation: formative, summative, and process. The formative identifies the issues, the activities, monitors progress, strengths, and you typically are doing that during program development. The summative measures those outcomes and effects, those changes in knowledge, behavior, and skills and attitudes and things at the end of a program. And process usually is also doing the program, those inputs that you have identified, and how things are occurring, facilitators, barriers over time. A lot of the formative and process work that you will do will use qualitative data. A lot of the outcomes will be the more quantitative data. So we're talking about questionnaires, surveys, pre-post tests. Sometimes you're using secondary data sources or information, say, your partner has versus data that you collect. And you're going to analyze that statistically. Doesn't have to be the most sophisticated statistics. Sometimes you're just doing averages, you're doing percentages, you percent change. So it doesn't have to be elaborate and complex all the time. Qualitative, it's interviews, it's key informant, individual. Sometimes you're doing focus groups. You might want to do focus groups with the kids to understand how they experienced this, how they felt about themselves when they were told, it might be important to engage in more physical activity, eat more fruits and vegetables. What about what they thought about their ability to accomplish that? You may want to do some observations when you have activities around physical activation. Which kids are doing it? Are the guys or are the young men doing more than the young women? Are there certain groups of kids that seem to do it together? Are there certain places where the kids are more active than others? And that requires qualitative data analysis. And at the end, you are simply putting together those analyses, the interpretation of findings, translating and communicating those findings, explaining results and providing recommendations, and beginning that communication process with your group again. Now, what I did not have the opportunity or the time to do in 45 minutes is to really talk you through the specific use of those quantitative and qualitative techniques and the data analysis part. But if you're working for a small organization and you're a one-person shop, you shouldn't feel like you have to do everything on your own. You may want to check in with other members of your organization to see who has what skill sets. And there may be people you can pull in to help you with that, but you can also build into your funding the opportunity to bring in consultants, people to help you figure out what questionnaires, surveys, tests to use, what data sources, and how to analyze them. And sometimes, part of their role is to help you figure that out, and then they do the analysis and they help you with the interpretation of the findings, both for the quantitative and the qualitative. Who the audience is for your results determines how deep you get into the qualitative. I do qualitative research. I love qualitative research. I spend months analyzing my data, but you don't have to analyze your data to that depth, and you don't have to use some of the techniques that I use. I have all of my transcripts professionally done. You may not need to do that. We detail code them. You probably don't need to do that. Identifying things is probably sufficient for what you want to do. So it's really important to be thinking about what you want to do and why you want to do it. I am going to stop my share and provide some opportunity to answer questions. And the first question is, will these slides be made available to attendees? I am willing to share these slides with the Black Funders team so that people can have them. And as I said, you can get almost everything I've mentioned here in greater depth if you go to the CDC website and log and use their self-study guide for program evaluation and the other tools and resources on their site. But we will make these available. I will prep them and send them to the powers that be right after this. And then Marilyn asked, do you recommend using the theory of change model first and then focus on the programs and the logic model? Yes, I think the theory of change coming first is helpful because what it allows you to do is the activities that you decide on should be linked to what you think are the important facilitators of the change that you seek. You need to understand what needs to happen for successful change in the behavior or the knowledge or the attitudes or the policies and practices that you're focused on. So it may be that every article you read, every person you talk to, every other organization says, You need to raise awareness around this issue first. We've never seen it work until there was some awareness increase in the community. So that is an activity that you might have to add in that you did not expect. Remember in the illustration that I was using as I was speaking, I talked about training people on educating people on healthy eating. You can't just say, eat healthy, add a fruit or vegetable to your diet and think that people know what you want. One, you'll find people don't understand the distinction between fruits and vegetables. And they may end up eating all fruits. And that's not necessarily what you want for healthy eating, because that actually could take their blood sugars up. And that's not helpful. And some fruits have a lot more sugar than others. That probably wouldn't be helpful. So you really need that education. And people don't necessarily know what a serving is. Some people think you have to eat a whole cup of a cooked vegetable for it to be a serving. That's not true. A half cup. But if it's raw, say in a salad, it would have to be a whole cup. So you really have to educate people so they can achieve the goals that you're setting for them in these activities. So yes, theory of change first. But once you've got that laid out, then I would go laser focus on my logic model, because that's when I'm going to start thinking about all those resources, detailing out all the steps in those activities and the outcomes that go with each one. And then I can start thinking about, how do I capture the benefit or effect of this?
All right, so it looks like we have one more question, and then we'll close out our program. First of all, thank you, Dr. Sanders Thompson. I mean, so much, just a breadth of information on the value of evaluation, as well as steps to help with the planning process. How do you develop that evaluation plan and use it as a communication tool, both internally and externally, looking at things from fundraising to budgeting to program planning even, and engaging everybody in that process. Not only your program team, but anybody that's going to touch evaluation, if it's the intake specialist to whoever is going to be involved in that evaluation process, as well as those that you are evaluating. How do you include them in that process? So I do have one question here, and I think it's Tawana Jones. I apologize if I mispronounced your name. What if the service line has no real time frame for services that vary in time? And for those that may not have any actual one, like an ongoing program, I think is what she's talking about. For example, an open play services for children program for children with certain diagnoses may not have time frame to reach a deadline. They can access this service despite making improvements.
See, and that's where you really want to think about, what are your goals? Yes, they can access the services even though they've made improvements. But at some point, you want to know, are they making improvements? Do those improvements seem to be related to the services access? If they're not making improvements, are they being linked to the appropriate services? This is where evaluation is not just about outcomes, but it's about improving your practice and your programming and your services. I don't want to keep linking people to the same old thing if it doesn't benefit them. I want to figure out, are there services that I don't have in my line? Are there services I'm not suggesting to people or linking them to that would be of greater benefit? So you don't necessarily have to have the same type of timeline, but what you might want to do is set reference points where there is some examination of the services that have been used, and the extent and a way of finding out from the people you're serving whether those services work for them, benefited them, and how, and whether or not at this point, given having that they've used those, are there new services that they need. So you can set it up, and here it can be kind of arbitrary. Maybe you do that every year. Once a year, you do an annual review. Maybe you do it every 6 months. Maybe if it's a long-term client, you cease to do it every year and you do it every 2 or 3 years. But you need to be thinking about that. I just encourage people not to get set on, we've always done it this way. and people fund us, so it must be great. We can always do better for our community.
Amen. And even focusing on having something quantitative, some evidence that you can use to share your story. And it's not just anecdotal. It's not just a satisfaction survey, but really something, a piece of evidence to show that you actually are achieving your mission. And that's something we should strive for as organizations. Now, that's awesome. So I'm going to turn this over to Marnay, who's going to close us up today. But thank you again, Dr. Sanders Thompson. This was awesome. Thanks for sharing your wisdom in this way. Marnay, it's all yours.
Thank you all so much again for joining us. We especially thank you, Vetta, for leading this discussion today, a very important discussion. And as Trina mentioned, what was very, very key to Vetta's presentation is evaluation should be considered essential and welcoming component of programs and services, not something that you should fear or you should shy away from, because that is critical to measuring the success of your programs and services. We invite you to stay tuned for our future Lunch and Learn series. They'll be coming up. We also in the chat have a link for you to give us feedback on today. Let us know how we're doing. And we especially like to know if you would like to have part 2 to measuring success. If so, please put that in your comments. Let us know, and we will certainly do everything that we can. On behalf of our founders and the Black Funders members, thank you all so much for joining us today.